Thank you so much for joining us for this, our first policy forum on a very, very important topic, childcare. The significance of this particular issue was raised for us when we began noticing what we thought was a concerning trend amongst parents whom we help get to work through our Vocational Services Program. And that issue is having childcare that is safe, reliable, and accessible. I say safe because no parent wants to worry about their child's well-being while they're working. We say reliable because parents may have to work odd hours or unscheduled shifts and will still need childcare. We say accessible because parents should have childcare options that are close to where they live and work. And no parent, for example, should have to travel past their workplace in order to have access to childcare. So tonight, we really have a fantastic opportunity to engage our very accomplished panelists who each have deep experience with this issue. They've graciously agreed to help us understand this issue more deeply. So I welcome Gerard Etienne, Pam Taylor, Tracy Clay, Ruby Daniels, Farah Najir Cantor, Yvonne Iskandri, and Delegate Gerard Solomon will join us shortly. At the end of the session, we'll have 10 to 15 minutes for questions. So we ask that each of you submit your questions as they occur to you using the chat feature. Now for our first two panelists, Gerard Etienne and Pam Taylor. Gerard first started at Interfaith Works as a volunteer for the Vocational Services Program in 2013. He quickly developed a passion for working for VSP clients, helping them with resume preparation, job searching, and interviewing skills. Gerard also served on IW's Board of Directors for 2 years, prior to being appointed Director of the Vocational Services Program in January of 2020. Gerard's career has spanned engineering and also business consulting. Pam Taylor is a member of Interfaith Works Board of Directors and also serves on the Advocacy Committee. In 2013, she was appointed to the Commission of Children and Youth by County Executive Isaiah Leggett. As a longtime advocate for families and children, Pamela has worked in the mental health field with diverse populations for over 25 years, expanding across multiple state lines, including Maryland, Virginia, and Georgia. Pamela has a strong background in family systems. She is a facilitator of Strengthening Families programs for the Montgomery County Collaboration Council and has served on Montgomery County Grants Advisory Group. Gerard, I'll turn it over to you. Why don't you start by sharing some of the challenges of childcare from your perspective and working with VSP clients.
Thanks, Courtney. I'd like to start off first by just expressing my appreciation and gratitude for this forum, particularly because my team and I run across this issue on a daily basis, on a regular basis with our clients. And, it's heartbreaking and frustrating, as that video has, highlighted, that this issue has been a barrier to employment for a really long time, but has been made significantly worse because of the pandemic, and particularly for the population that we work with at the vocational center. So 75% of our clients are women. 87% are people of color. And so it's very easy to see the very harsh impact that the pandemic has had, particularly when it comes to women, and particularly when it comes to childcare. And what we're hearing from parents is pretty universal, I would say. And parents are left with very limited choices when it comes to employment, seeking employment, and seeking childcare. We have of our clients, approximately 40 of them, a little over 40 of them, have children who would require daycare. We serve 210 clients, so that's approximately 20%. And out of those 20%, I would say less than 2% have attempted to get childcare through a voucher. The remainder have tried to get childcare through other means, which are not necessarily safe means. We have a handful of clients who have children with special needs, and the challenges for those parents are really difficult to put into words. So this is a significant problem for our client population. In terms of, and I would actually like to ask you, Pam, in your work, what have you been hearing yourself from parents as they look to return to work?
Thank you, Gerard, and thank you, Courtney. And again, I agree with you. This is a very important topic. Pretty much the same thing that you've already mentioned, Gerard. I often hear from parents that they lack support as well as affordability. Very difficult for them to attain a child care voucher when they're looking for a child care voucher. Maybe it's because they are either over income, a little over income, or they don't have any income at all. So they often are pressured to decide whether they're going to go back to work or not, because oftentimes these parents have multiple children that require child care. And even if, another point I want to make, even with that, sometimes when they get a job, the schedule doesn't always work out for them, where they can go either pick up their child, drop their child off in the morning or pick their child up in the afternoon. And then they are penalized and they are charged all of these fees for coming to pick up their children late.
Yeah, we see very much similar things in our program. And I think it's really important also, just in the context of, obtaining vouchers or finding childcare, the context in which many of our clients are living, financial instability, potentially housing and food instability, mental health issues, whether it's them or their children. Illness. We've had several single mothers come down with, and actually entire families as well, come down with COVID. Unemployment, the language barrier for our Spanish-speaking clients. So approximately 35% of our clients are Spanish-speaking, and trying to go through this process and not knowing the language is also a massive barrier. And essentially what we're seeing in some of our clients is that they've given up on at least trying to attempt to get the voucher. And when they do get childcare in other from other sources, as you said, the issues with work schedule, not necessarily feeling comfortable with where they're leaving their children. I mean, for those of us who have children, that is an existential thing that you just can't get over. You cannot put your child somewhere where you don't feel that that child is going to be taken care of, much less a child with special needs who the provider, maybe a family member, is not trained at all to deal with these issues. So it's a very, very challenging problem from our perspective. And Pam, I would ask you, and I will answer that question myself later, but what would you like our elected officials, government leaders, advocacy organizations, nonprofits, what would you like, who are looking to address this issue, what is one thing that you would want them to know from the parents' perspective?
as a single parent myself and raising two daughters, my children are now teens, but I remember being in that category where I was a single parent, raising my two daughters and needing child care vouchers and not able to attain child care vouchers. I believe I have the perspective of the parents, and speaking to some of my my clients, they want to work. They will love to work. They want to get out the house and be able to manage, you know, being employed and caring for their children, but they want their children to be safe when they drop their children off and they go off to work. They want to be able to make a livable wage and a decent wage and know that they can manage both the child care and the other household responsibilities. Oftentimes, that one parent is all that child have. So they are responsible for all child care, all the costs associated with their child. So that's what I would like the you know, the panel to know and the policymakers to know. These parents, they need a livable wage. They need help and support in attaining more child care vouchers, more support with child care costs, so that they can get out and they can work.
I'd like to thank you for that. I would like to echo what you said earlier in your comment, which is the same thing with our clients. Our clients want to work. They tell us they want to work. One of the things that I think is very important and to combat is this perception that you often hear in the media with talking heads that you know, people are just trying to take advantage of the system. From our perspective, from the Vocational Services Program perspective, nothing could be further from the truth. Of course, you know, there are some people who may try to take advantage of the system, but the percentage of people who do that, I would, you know, argue very strongly is no different than at any other socioeconomic stratus, whether extremely wealthy, middle class. Our clients want to work, and that's what I would want, you know, leaders and advocacy organization, nonprofits to know. I want them to know that some parents are desperate and have no viable solution. They're literally in an impossible situation and they need help. That is the biggest message that I would like to get across.
Thank you, Gerard.
Absolutely.
Yeah. Thank you very much, Gerard and Pam. We certainly appreciate you offering your perspective here this evening. Our next guest is Tracy Clay, who is the Executive Director at Celebrity School, Germantown. She's an adjunct instructor for early childhood education at Montgomery College. She was a licensing specialist from 2007 through 2019 for the county and served for 3 years as co-president of the Maryland Association for the Education of Young Children. Thank you for joining us, Tracy.
Oh, thank you for having me, and what an honor. Wow, I feel like I'm having post-traumatic syndrome just hearing from Pam and Gerard about what they're talking about it, because I am literally in the thick of everything that you have mentioned. First and foremost, Celebrity School in Germantown was one of the centers that stayed open from day one of the COVID back in March of 2019. At that time, our center had 121 children, and we dropped down to like 41 in a matter of a week. The impact of that, as I think Gerald was mentioning, is that I had to lay off half of my staff while managing to provide the care to our essential personnel. At the same token, it was very heartening when we heard the announcement that they closed down the schools, that at first they didn't even think of childcare. That was an afterthought of the impact of whether either just to close them down right then and there, or when they realized what they had to do, but actions were put into place. So in the short amount of time that I've had here, and again, Gerald and Pam really hit the nail on the hammer on a couple of things. One of the things that I'm facing and seeing as an executive director is the process of the vouchers. Yes, money was increased to make it more affordable or accessible for families. I think that needs to be looked at again. I know there's a schedule that it increases every year, but the impact of COVID, I think, needs to expedite them relooking at the amounts so that more families have access to childcare on that. The process itself, I can almost tell you, is embarrassing. I literally walk parents hand by hand with filling out the form, making sure they have the document, scanning it over, faxing it. And yet almost 30 days to their submission, they're given a notice saying that it's being denied because a document was missing. They never get to talk to the same person or get a caseworker where they get to work on a one-to-one to walk them through the process. I think, and I may be wrong, I think it's something to be looked at. I think they're calling a call center that people are not trained, and they're given different answers every single time for the process. This delays the family from actually starting their work because they haven't secured childcare. Celery tries to work with parents by having a flexible schedule. You mentioned the hours. We are one of the centers that open up from 6:30 in the morning till 6:30 in the evening. And literally there are some children that are dropped off at 6:30 in the morning and are not picked up until 6:30 in the evening. I think one of the things that Pam also mentioned about, I think because I have over 45 years of experience in early childhood. I was also a provider myself for 23 years. I worked for MC Public Schools for 5. And as you heard, I was a licensing specialist. So I really do have a very unique perspective from all sides. But things like knowing that I have a single mom who's working and who literally would arrive to pick up her child 6:30, 6:45, 6:45. Not once as the executive director did I charge her the late fee. She was trying to make her living. She was doing her best. I will take the brunt for it when corporate finds out that I didn't charge a late fee. But anyway, that was, you know, I think I did the same thing as a licensing specialist. And I took the term specialist very endearing, where I felt like as the agency really wanted us to be inspectors. You cite it, you see it, you cite it, vice versa. But again, you always have to look at the circumstances around each family and try to meet them at their need. Another thing that was mentioned is when the school closed down, I don't think they took into factor children with special needs. We were quickly to turn around to do virtual learning for those kids that were doing the virtual learning. But clearly we saw that the virtual learning was not meeting the needs of these children who had special needs. And that was a total injustice that happened in that whole process. We did the best we could. We were not trained in that field. And so therefore a whole year, if not more, was lost in their academic pathway. You talk about COVID and illness. It's our new normal, people. As of today, on August 11th, I had to shut down 4 classrooms. So that was over 60 parents, 60 families that I had to quarantine for 14 days. The expectations and the guidelines given to us is so strenuous that the stress that's on my team and myself every day to try to meet the needs of these families and yet meet the need of the safety, it's an uncharted territory and nobody's really talking about it. You're asked the questions about runny noses, coughs. Yes, the temperature is an indicator, but there are other things that are uncharted that we have to determine for the safety of all the kids for one particular kid. We do screenings now before they come in. In all honesty, we send it to on an electronic basis. And I had to go to corporate and say, there are parents who could lie. They take their temperature outside the building. It could be high, but because they have to go to work, they're going to say that it's a normal temperature. They're going to say that, no, my child doesn't have diarrhea, no, this and that, whatever and stuff. We find after the fact. So this is an ongoing battle that we're having in the heat of the battle of COVID. And now with this new variant, the Delta variant, which is really affecting our children. We're getting ready to face the opening of the schools. So it was also mentioned, I think Gerald mentioned about the stress of these parents. Literally, I think I need a couple other degrees or specialty training for being a psychologist, a doctor, a lawyer, a pastor, call it what you want. I'm dealing with all levels of these families, as you said, trying to make it. They want to go to work. Everyone wants that sense of normalcy, but even the reaction of face mask on, face mask off, these different, you can go here, but you can't go there. So, and ultimately I have to advocate for the children themselves. I've mentioned since back in the last summer, the emotional and social development of these children are being impacted by the invisible monster called COVID, and how on one hand they had their parents home where they were able to manipulate and have their needs met immediately, then all of a sudden being sent back into childcare. Where's my mom? How come I'm not home? Why do you have your face mask on when they didn't? It's just very frustrating. But if I had to tell you to focus on one thing to advocate, we talked about, the affordability and accessibility. When I see what parents go through the voucher system, it's got to be relooked at, and it's got to be really supported. And it's got to be where what the mission is, and not so much of always, no, you can't. Why are you waiting until the 30 days to sit there and say you're going to deny an application when you didn't get a document, or you're missing a number, or you're missing a current pay stub? Work with these families. They're trying to go to work. Some families are losing jobs because we tell them that, yes, we will accept them on a $50 deposit, but after 30 days, if they don't get the vouchers, then they're responsible for paying. Our tuition for infants is $477.50 a week. And I also have to tell you, there's an undercurrent wave that's hitting the child care field for those of us that are opening. And I hate to use the term, but it's what we are getting a amount of infants, people who got pregnant during COVID, during lockdown, and there's going to be a shortage of infant care. So get ready for the second wave. Not only do you have the shortage of childcare in general, but within it, it's going to be a shortage of infants. So
that's amazing, Tracy. And, I think what you hit several points there. One, it's been a really challenging year for childcare providers. And I know that often when we think about the need for care, we often think about the demand, but we don't necessarily think about the supply, right? Like that you're providing a service, and as a provider, it's not so much a niche market, but it's very challenging, and we need to be thinking also about how we can help the providers have enough capacity. So you talked about capacity, you talked about having to quarantine children. You didn't mention, or maybe you did and I missed it, having to that also meaning you would have to quarantine the teachers. And so
absolutely, yep.
That's an impact on you on that side as well. So what, maybe this is an assumed question, but you also talked about the high cost of childcare and the fact that vouchers need to meet the need. What would you say might be one of the reasons why childcare costs are so high?
Well, one, it goes back to, if you're now the employee, as Gerald was talking about, people want to make a decent living. And that's a challenge that's actually causing a shortage in childcare. So Montgomery County just went up to minimum wage of $15 an hour. Great, wonderful. But I got people who can actually go to Target or whatever and make $17 an hour. And then the qualifications, that was another demand that was put on childcare, along with the Kerwin Commission, as far as, we want people to be qualified. We want to get that to that professional level. But in order to get there, people need to make an affordable living in order to get qualified. It's like a catch-22. But it's one of the, y'all just have to come visit me and we'll have to have one-on-one conversations. It's a lot, but if we're just talking about, like I said, focusing on the child and the family, again, if the vouchers were supporting to make it affordable, and Montgomery County is comparable. We've had people who've actually had to come down to, Celebrity has 27 schools. And so let's say there's a family from Frederick, their school is full, so they send them down to us. They literally drop their mouths from the difference of what the tuition is for Frederick compared to Montgomery County. Again, Montgomery County is one of the highest minimum wage paid counties. It is the highest cost of living. So you have to pay more or try to get to that level so that people, and this is the other thing, most of childcare providers have 2 jobs. So that's the other thing. But again, that's nothing normal in education. Even some of your MCPS teachers have a second job in order to supplement their income for the cost of living in Montgomery County. So it's a catch-22 on that one. I hope I kind of answered your question.
No, that you absolutely answered my question. That makes perfect sense, that the cost of childcare is reflective of the cost of living in Montgomery County. Very good. Well, thank you so much, Tracy. This is turning out to be so much more helpful than perhaps we even thought as we were planning this. So thank you so much for your time.
Thank you.
Next, we have Ruby Daniels, who is the president of the Maryland State Family Child Care Association. She's been a family child care provider since 1993. Prior to her position as president of MSF-CCA, she was the vice president of education and the president of the Howard County Association. And I believe, Ruby, you've got a presentation. Yeah. Fantastic. Welcome.
Well, thank you so much. It's truly an honor to be here. And I would echo Tracy. The family child care providers are also having issues with the child care scholarship program, payment delays, difficulty with the voucher. We're not having email confirmation, voucher confirmation. Like I myself have to let one of my clients go with not paying for 2 months because the voucher was kind of messed up at some point. They're missing some papers and they didn't know. So that experience is being echoed by family childcare providers as well. So I myself was a parent back in 1990, and this is my journey from a parent to a family childcare provider. I also had a hard time finding childcare. I looked and I looked, and I couldn't find quality, and the quality I couldn't afford. So the search was actually difficult. And if you look at it now, even a young mother that's searching for childcare, it's really hard to navigate the Google and everything. It's hard to find childcare. It's hard to, find the right match. That's what I'm saying for childcare and stuff. And, and I think that's also, as a parent, added to, to the stress and anxiety as a young mother that you're looking for care. So I couldn't find care and the cost was really high. And I figured, why not start my own daycare? So this is another path that parents who can't afford childcare or parents who can't find childcare, they can open their own business. This is a good in-home business. You can be home and raise your child. And if you're really interested in teaching, this is a perfect career for that young mother who has a hard time finding childcare. It's an alternative. So that is how I got started into the business. Now, looking at it now, back in 1990, it was so much easier. We were under the DHR, Social Services. And it's not like what Tracy was saying with licensing. Licensing now is see it and cite it. Back then, with social services, it's more of a mentoring. They come to your program, they tell you, this is how you're going to do things. This is wrong, you shouldn't do this. I'm gonna come back and make sure that this is gonna be done the next time. So it's more like, I'm gonna guide you to have a quality program and an excellent program. So that we have to look at. Now, the barriers of becoming licensed, let's say a young mother wants to become licensed in Montgomery County. The training is about 45 hours in order for you to become a licensed family childcare provider now. Back in 1990, it was 12. And it was a quick visit from social services and the fire marshal, and you're done. You can start working. Now it's a lot more requirements and it's a lot harder. Now, if I'm a young mother with an infant child, who's going to take care of my child while I go to the training? So childcare is a barrier. Where am I going to find somebody to watch my child? Now, another thing to think of is the startup costs. Now you have so much requirement, like you need criminal background check, you need medical for the residents, for for your assistant, for your substitute. So if you add all that, it will require, the training would be around $700 that you have to pay out of pocket. Why can't we provide that for free? I think we have to advocate that that should be given to the providers that are opening in Montgomery County for free. I mean, it's pretty simple, you know. The startup cost, it's an additional $700 to do all your fingerprint and medical and stuff. If I'm a young mother again with an infant child, where am I going to get that money? The startup cost is really important. Housing, of course, now, as you said, Courtney, that there's a lot of housing insecurity and stuff. I mean, if I'm a young mother and I'm struggling and my housing is, not really guaranteed. So that's also one of the barriers to becoming licensed. And of course, the added requirements of being licensed is also a barrier. But it's going to be a good career for somebody who's like me back then that couldn't find care for my children. It was a good career. My proposed solution is a recruitment and retention to expand the Montgomery Go FCC program, to kind of use family childcare providers as business recruitment, to recruit other providers into the field. And also maybe use Interfaith Works to recruit also providers. They can send it our way. We can mentor them and then show them how to get started. I mean, it's a good career, for people. You can increase the workforce and at the same time increase the capacity, because that's the biggest thing. The increased demand is driving the costs, yet still we're not making any money. So, but it's really, if we can just explain how things are, if you look at the bottom line, it's really not that much, because 25% goes to taxes, employees. I have to pay my employees, I have to pay the mortgage, utilities and stuff. And at the end of the day, there's not enough left. So the other thing is provide more financial literacy for the family childcare providers in order for us to stay in business. I think Montgomery has that financial literacy program, if they can expand that. And also invest in peer support initiative from the Family Childcare Association of Montgomery County. Maybe use them as a support so we can keep the providers from closing. And the last thing is to match the parent to a provider. Right now, I think there's only one program, which is the care.com, that can match the parent to the provider. And if today, when we were searching, because a lot of the younger generation, the millennials are all already having babies and they're looking for care. And how they look for care is through Google Maps. So I tried the Google Maps and Montgomery Childcare, and not a lot of the family childcare providers were there. And it's a simple thing to do. You just sign up and you're there. It's a good marketing tool. So we're lacking those kind of tools to give the parents, so the parents can find us or us, or to match both of us. So I think that's a big thing that we have to look at. Now, the family childcare in 10 years, with the universal pre-K program that's coming in 10 years, we're concerned that more programs will close, leaving more families with fewer childcare options. Currently, there are barriers to family childcare participating in the pre-K expansion, one of which is you need to have a bachelor's and a teaching certificate. On average, it would take a provider 10 years to finish a bachelor's degree. And most of the time, if they have a bachelor's degree, they're not going to stay in family childcare. They're going to work in the public school with benefits and a better pay. So the solution, I would think, would be for us to advocate for parent choice. Parents should be given the choice of what's best for their child, and that includes the right to choose a provider. That could be a provider without the degree, but is knowledgeable about teaching the whole child. Someone who can provide the love and care and the emotional support the child needs, especially a child that can thrive in a small group setting. Lastly, in terms of advocacy, I know Tracy was saying something about, let me loop around the childcare subsidy. I think we should advocate to increase the rate for providers to show the actual cost and not the market rate, because I think that should be a basis. And also to increase the eligibility requirement, the eligibility income for parents. So like, for example, a mother who's working in McDonald's and who's earning $15 an hour, and then has a spouse who's also earning about the same amount, they will not be able to qualify, so but still they're not making that much money, but they're not able to qualify because they just went over the threshold. Another thing is we have to remove or make it easier to waive the child care support requirement for parents, because a lot of the parents, that's a barrier. They, like, if you're in a bad situation where you can't chase your previous spouse, so I think we have to remove that.
That is fantastic, Ruby. I think what you've laid out for us is sort of one of the ways that we could really expand the stock of childcare providers which we've just been talking about, frankly. So how we can not only sustain now childcare operations, but perhaps how we can grow capacity into the future. And I think it was you, Ruby, or perhaps I think you mentioned this thing out here called pandemic babies, right? So we know that there are more babies who are going to need to be cared for, and we're going to need more childcare providers. So fortunately or not, this is one of the areas of real growth that is going to be needed in Montgomery County, and the need is only going to increase. Thank you so much, Ruby.
Yeah, we can support them.
Great, thank you. Okay, next we have Farah Najir Kantor, who is the program manager at Montgomery Moving Forward. She's previously served in senior roles at AIDS United, a national HIV and AIDS policy and advocacy organization. She has a distinguished background in international development and public health. Farah will be sharing an overview of Montgomery Moving Forward's work on early childhood education and their future advocacy priorities. Farah, thank you for joining us.
Thank you, Courtney, and thank you, Interfaith Works, to invite Montgomery Moving Forward, which is an initiative of nonprofit Montgomery, to be a part of tonight's conversation. And see a lot of familiar partners and faces here too that we work with. Ruby being one of them, and Delegate Solomon, members of the HHS. It's just really great to be among friends. So I will say that my connection to early care and education is not only through Montgomery Moving Forward, but I'm also the daughter of a childcare provider. After immigrating to the United States about 30 plus years ago, my mom has been a lifelong educator and providing childcare to countless children, and she was forced to close her center last year as a result of the pandemic. So this issue really hits home for me as well. So I will share my screen, and I'll start by saying, if there, let me make sure I'm doing the present mode. All right, so if I have three hopes that you'll take away from tonight, it's that you will get to know a little bit more about Montgomery Moving Forward's work. And I might just shorthand it to MMF as we talk. Two, that you'll have a better understanding of our current and upcoming advocacy. And 3, that you will join us and get involved, because we really know that raising the collective voice, and now especially, is so important to making the most of this moment, which for better or worse, COVID has really opened up for us, right? So a little bit about background for MMF. So we started as a collective impact initiative about 7 years ago. And what does collective impact mean? So we bring together partners and stakeholders from different sectors with the shared, in an intentional way, with the objective of sharing resources, information, time, talent, towards the shared goal of solving a complex problem. And early care and education is a complex problem. I think it's as complex as they come. And I'll probably also shorthand early care and education to ECE, just so I can keep to my time too. So we started working on the issue of workforce development, and then about 4 years ago started to really hone in on early care and education, or ECE, because we recognized that ECE is a workforce issue in so many ways. So when you look at what's on the screen here, right, our reason for focusing on this is grounded in equity and the fact that ECE is an economic imperative and an equity imperative too. Now, this data from the Maryland State Department of Education from last school year showed that about close to 50% of the Montgomery County school children were not ready for kindergarten. And we know that the disruptions, not only in academic learning, but in social, emotional, mental health development, is going to likely increase that percentage in this coming school year. And it may even trickle over into future school years as well, and future years of development. We see here that the justification, the reason for investing in early care and education really is significant. And it is an investment in the workforce of tomorrow as much as it is an investment in the workforce of today. We're able to see that when you invest in childcare and quality care and education that is affordable and accessible for children birth to 5, it not only pays off academically for that child, but it pays off professionally and in their long-term, lifelong development as well. And it also helps to strengthen the workforce of today, which allows, and by that I mean, we allow parents to be able to feel at peace with themselves. A parent of young children myself, that I can leave my child in safe, quality, nurturing environments while I can either enter the workforce for the first time or return to work and advance and grow and be able to continue to contribute to my family and my community as a whole. So the justification for early, sustainable, affordable, equitable investment in ECE is not understated, right? Something that it doesn't show up on this slide is something that Tracy touched on, Ruby touched on as well. But it is also that investing in early care and education is an investment in small businesses. And a lot of these small businesses are led by women of color often, who are largely invisible and have not been valued for the fundamental role that they play in building that next generation. And it's high time that we corrected that. I also want to call out that MMF advocates for more equitable and sustainable public investment in ECE. And I think Tracy and Ruby, you both touched on this as well. Now, what you'll see on the slide, it shows in raw numbers what we already know and what we've already talked about tonight. And that is that parents pay a disproportionately high share of the cost for early care and education in the county. And it's not just here in Montgomery County. This is a national phenomenon. So while the numbers and the data on this slide might be a couple years old, the reality and that high disproportionate burden is certainly still existing, and it's still a reality that we've got to confront. So all of this really underscores what drives Montgomery moving forward in our early care and education work. And we really have these 3 goals at the forefront of the work that we do. And that is to ensure that every family with young children in our county will have access to affordable, high quality care and education. and that our children will enter kindergarten not only ready for school success, but for overall success. And that our employers will be able to attract and retain skilled and productive workforce and workers today and into the future. And I will add on to that, that we will also value our ECE workforce in the way that they are deserving. So given all of what we've talked about, it is no surprise, and we already know that the early care and education system was pretty significantly strained before COVID hit. And what the pandemic succeeded in doing, if you will, was to quite literally break the system. And it also succeeded in putting early care and education into the public eye in a way that hasn't happened before, as we saw in the news clips that was shown at the top of of today's program, right? So we, Montgomery Moving Forward, back in April of last year, really sought to hone in on our collective impact work and bring together a diverse group of partners from across Maryland, DC, Virginia, and some even with a national footprint to join in this early care and education workforce advocacy coalition. And our goal in doing this and bringing everybody together to join forces was foremost to make sure that the reality that the early care and education system was seeing and facing was at the front of mind for our decision makers. And second, we wanted to make sure that we had not only the recovery of the system in place, but that resilience and sustainability would be a priority throughout the pandemic, and that we would really be pushing for not only to build back the system as it existed before, in fact, to not do that, but to really think about building a more resilient, sustainable system that could withstand not only the shocks of the past, but any future shocks. So it was a tremendous, and it has been a tremendous opportunity to really come together and work in a collaborate cross-sector way. So our priorities over the last year, 2020 to 2021, really largely focused on what you see here. For much of that year plus, we have been calling for immediate relief recovery and funding for childcare providers. And some of what we have done, well, I'll mention that in a minute. We also really called for supporting childcare providers to be able to provide school-age care during virtual learning. Not everyone has the ability and luxury of working from home, and even some who do still needed to have their children in structured, supportive, and nurturing, caring environments to help them with their school. We also called for increased access to vaccines and recognizing childcare providers as an essential workforce that should be prioritized. And this fourth point really is a cross-cutting part of all of MMF's work and advocacy. Again, keeping equity and transparency at the forefront, but also making sure that the processes in place that came down after the pandemic for providers to access grant funds were accessible and truly accessible to family center-based providers and that run the gamut. So some of what we did during that last year, for example, nonprofit Montgomery provided technical assistance to childcare providers in the county to help them with the application process for a county grant program. And then we continued to provide technical assistance over the last 9-10 months. Along with the coalition, we worked with state level partners like Delegate Solomon, Senator King, and others to raise awareness and to keep ECE really at the forefront and support a variety of legislative pieces that were being put forward during the past legislative session, General Assembly session. And we also worked really closely in trying to influence, or aggressively rather, in trying to influence Governor Hogan and his team with their pandemic relief grant program that they released last February, recognizing that these are all pieces in a big puzzle, and there's still much work to connect the dots and really think about this work in a long-term, with a long-term view. Locally, I put some related activities on the slides just to maximize the time I have with you, but we also do a lot in educating the community and raising awareness around this issue. And you can check us out online to see some of how our 2020 community symposium that looked at the impact of the pandemic on the childcare system, some of what was covered there and some of those resources. And, you know, this has come up a little bit already, but last year we also released an English-Spanish toolkit for employers, really focused on employers to help them to be able to better support their employees with directing them to resources and helping employers to think more creatively about the kinds of supports they could put in place that could help to retain skilled employees and grow their workforce. So in looking at, yes.
Quite a bit, Farah. I think Montgomery Moving Forward, or as you're calling it, MMF, really has done so much in Montgomery County and really sort of serving as the catalyst in many cases, as I was able to see anyway, for a lot of this attention, much needed attention around childcare. Would you mind putting the link to the Montgomery Moving Forward site, particularly that early childhood education kit? I had a chance to look at it. Very, very interesting and very, very helpful. And I really appreciate you spending some time with us here this evening.
I will definitely plug it into the chat. Courtney, if I can abuse my time by just saying
maybe 30 more seconds. So
30 more seconds. Okay. Well, right now we would love to have Interfaith Works and other partners on the college join us in our advocacy efforts unrelated. Please follow up with me directly. And I just want to say that presently and into the next legislative period, we are focusing really on helping to bring parent and provider voices to inform how the American Rescue Plan, these federal funds for childcare, will be used. And there's an upcoming advocacy opportunity to really weigh in and inform that process and let the Maryland State Department of Education know some of those key priorities. So definitely want to mention that. And again, just as many voices as possible. We want to be working and learning alongside with you. And I'm so grateful to be able to share this space with you tonight. Thank you so much and so sorry.
Thank you so much. And if you would drop as much of that information into the chat, particularly those links, like the sign up, that would be very useful. So thank you. Yvonne Kandri serves in the Office of Eligibility and Support Services at the Department of Health and Human Services, where she oversees eligibility for support programs, including the Working Parents Assistance Program. She will share with us an overview of the WPA and the supplement program. Yvonne, thank you for taking the time to join us this evening.
Thank you for having me. And let me see, get on to do the sharing. Okay, do we have can you see my?
Yes, we can see it.
Document? Thank you, thank you. And so I do want to take this opportunity to thank you, Courtney and Joe and all the panelists and participants this evening for inviting me to this forum as I listen in to everybody that has shared their wealth of information and knowledge. I must say that it does break my heart to hear some of the things that have been talked about, and knowing that, you know, there's a lot of work that we do on our side, and clearly there's a lot more to be done, and we are working on. But I want to bring some assurance that we are hearing, we are listening, and that we are making strides. And so this evening, I just want to talk quickly about the WPA, the Working Parents Assistance Program that the county has. You know, we pride ourselves as Montgomery County having this program back in the 90s that no other jurisdiction in the state has, and have been working to make sure that I hear most of you, I think it was Ruby, it was Tracy, also talking about the cost and the eligibility for parents. And so I know that it's very difficult for families to be able to pay for childcare. I was a parent of, 2 young people back in the 90s, and I understood. I must say that I benefited from the childcare. Then it was childcare subsidy programs as a young parent who did not make a lot of money to be able to afford care. And thankfully, I was able to have that for my children and be able to put them in a safe environment where they could thrive. So I understand clearly. So Working Parents Assistance Program, I'm not going to go over everything on the slide, but clearly it's a program that was developed to help families residing in Montgomery County to pay for childcare. Understanding that there's a need for safety so parents can aim for a productive life and a better future for themselves and for their families as they contribute in the workforce. I'm sorry. Yeah, our goal is for family self-sufficiency because parents are able to work, and for children to be in safe quality childcare environments. I heard Courtney talk about, safety, talked about the quality of the care and the accessibility of the care. Now, again, we are regulated, very regulated. That's what government is. And so we have requirements for these programs, for this program. And you must be a resident in Montgomery County. You must meet the income guidelines, employed 25 hours a week or more, participate in an undergraduate or vocational program full-time, or participate in a combination of both work and school. And I also heard about child support. And today we have that in our regulations, in our requirements. Or I also want to let folks know that you can claim, an applicant can claim good cause if there is issue or any issues around child support. We recognize that sensitivity and we also look at that. We also like everyone to know that a parent does not have to be a citizen or have a social security number to apply for a US child or a child that meets legal permanent residency. Now, the children, of course, that you're applying for must meet the citizenship requirements. They don't have to be a US citizen, but they must meet citizenship requirements. And they must be placed in a licensed center or licensed family care that's registered. Okay, trying to navigate all of this at the same time. And the income guidelines. So now, also I heard about affordability. Where the state scholarship program ends is where the Working Parents Assistance Program begins. So I have the income guidelines here to share with everyone, and this is something I can share post this presentation. In addition to the Working Parents Assistance Program proper, we also have the supplement that we have. And this is a supplement to the state scholarship. So for those children who receive state scholarship and what the benefits that they receive in their rates for the state scholarship is less than the WPA, we augment it. We pay a provider up to. Parents don't have to apply for it. We get this information from the state and we apply the supplement. And here I have how you can apply for the WPA program. And while today we do not do eligibility for the state scholarship, we do have information to share about the state scholarship. Once upon a time, I had Ruby talk about the 90s. Well, up to 2016, 2017, we were doing eligibility for the state scholarship program. Then it was the subsidy. And the Maryland State Department of Education took over that program, and so now they determine that eligibility. Again, the state scholarship program is funded by the state of Maryland, and it does similarly to what the WPA does. And their income requirements also, they must meet the state income guidelines, be employed similarly to the WPA, and or the participants could also be receiving temporary cash assistance. And if they are receiving temporary cash assistance, they get to work with our workforce development partner, Equios, through this process in trying to gain employment. Again, there's the child support requirement, and if there's a parent that's not in the household, and there is the social security number requirement. These are all in regulation. Here we have the current income table, again, that you can take a look at once I share this information with everyone. And we have their mailing address, well, not the, yeah, the mailing address, the contact number. I had someone talk about the call center. Yes, that's how the state operates, and they have a website where one can email their applications. Now, I also wanted to highlight what we have done, the county has done for providers during the pandemic. Again, nobody expected this, it came upon us. And so quickly, the county put into effect under the Department of Health and Human Services, resources to assist providers and families. So we had the Essential Provider Care Supplement. And again, you would see what that did. And it was a distribution of 1.2 million. We had the Early Care and Education Relief Grant that's also ended. And you would see where 6.6 million was distributed among and across center providers and 3.6 million to family providers. We had the school age provider grants for children ages 5 to 13 to further assist providers who we are working with parents on their children to accommodate virtual learning for those MCPS children who we are not in school. And that was a $1.6 million spent. And then we have the school age scholarship subsidy program that's ending at the end of this month. And this one assisted parents with additional costs for the virtual day program that children had to participate in. And over 700 applications were processed, 805 children processed for vouchers, 50 center providers were paid a total of 2.1 million, 25 family providers paid 249,000, and specifically served children in foster care 130,000. Now you would ask, that's okay, with all of this and with all what I've heard this evening, clearly everybody knows that the Child Early Care and Education Initiative is one of County Executive Elrich's 7 priorities for the county. And so over the past few years, we have been working as a member of the Early Care and Education Steering Committee. We've been working day and night with hearing, listening to providers, to families, to children about these concerns, and are working tirelessly to bring some much needed augmentation to the child care system. So some of the key things that we're working on right now is a community connect system for filing applications that parents could use to file their applications. Also working to tie that with locates for childcare. I also heard about the difficulty for families to look for and be able to find safe, quality childcare. We're looking at increasing the federal poverty level for the WPA program in November of this year, which would be an increase after 2 years, because the last increase we did was in 2019. We are also looking at amending the WPA program regulations to include some of the things that we have heard from advocates, from families and providers. We will, the initiative is also looking at piloting a funding of seats in childcare programs. They're looking at contracts with providers for subsidy seats and funding seats for 3-year-olds aging out of early Head Start. So those are just some of the things that are underway that the initiative is seeking to improve and help increase childcare expenses, just childcare programs in the county, to ensure that county residents are able to not only have access to childcare, quality childcare, but that it's affordable for families also.
Thank you. Thank you so very much, Yvonne, for sharing with us.
I will wait to take questions when we get there.
Yes, we will have a period of time after for questions. Thank you so much.
Thank you.
Now, okay, I think you've got to stop sharing your screen, Yvonne. So finally, but certainly not least, I'd like to welcome Delegate Gerard Solomon, Maryland Delegate Gerard Solomon, who represents District 18 in the Maryland House of Delegates. He is a member of the Appropriations Committee, where he serves as the Vice Chair for the Education and Economic Development Subcommittee. Prior to his election to the House of Delegates, he was a policy advisor for U.S. Senator Bob Casey, where he advised on issues related to childcare and early learning. He served as the Vice President of Budget Policy for First Focus, a bipartisan national kids advocacy organization. Delegate Solomon began his career teaching social studies at Northwestern High School in Baltimore City. He has been a leader on childcare policy in the General Assembly. He was the sponsor of the Childcare Provider Act during the 2021 legislative session. And he also has small children, so he really gets it. Thank you for joining us, Delegate Solomon.
I'll make sure to unmute myself before I start to talk. You'd think I would figure this out by now. Thank you, Courtney. It's a real pleasure to be here, actually with a lot of familiar faces. And I just want to start off by thanking anybody who is who's currently working in direct services, or certainly in the childcare field, who's running a center or running an organization. I know how difficult this time has been for you all, and frankly, I mean, I don't say this lightly, you truly are heroes for what you're doing and the services that you're providing. So just wanted to start off by saying thank you.
Thank you so much. And you're absolutely right. We echo all of those sentiments. Can you tell us a bit more about the Childcare Provider Act that you sponsored this past session?
Yeah, and I will say I want to again thank Ruby Daniels for her advocacy and her help, and Farah and the folks at Montgomery Moving Forward for their help. It's really in some instances it's really wonderful to represent Montgomery County because we do a lot of really great policy here, and it provides a really great template for things that we should be bringing statewide. And so Ruby had mentioned the Go FCC program, the Growing Opportunities for Family Childcare, and what we did was, when we started off, sort of planning for this past legislative session, it's sort of funny to think we were planning at one point for potentially a $2 billion shortfall in the state budget. We didn't know whether we were going to get money from the federal government. We didn't know sort of what the economy was going to look like. Now, instead we're dealing with the much better problem of how do we spend all the money that we're going to get, and what kind of improvements and and changes to the systems can we bring. But back then we were thinking, okay, we don't know that we're going to have a lot of money, and we want to do something. We want to begin to make baby steps towards really improving and growing the supply here. And we have this great program in Montgomery County that really over the last 3 years has created, I think it's upwards of potentially 60 new family childcare providers. And what it does, as Ruby sort of mentioned, is really kind of a soup to nuts program of, from the beginning, identifying, folks within the ecosystem of childcare who may want to open up their own family childcare businesses. They may be assistants, or they may work at a family childcare center and they want to become providers themselves. And so how do you provide the training, the mentorship, the back end systems information, that if you're skilled at working with kids, you may not have any idea how to design a budget, or you may have no idea how to navigate the licensure process, or the myriad of other things that go into really owning your own small business. And then work with those people, provide training to them, provide support, provide help with the startup costs, provide the mentors, provide the networking opportunities that Ruby had mentioned. And so the program in Montgomery County has again been wildly successful, and we know, in particular, it really it hits a number of birds with one stone. You're creating family sustaining wages for often women and women of color, oftentimes from low income backgrounds. You're providing a service for communities, usually of immigrants. When you look at the number of languages that are spoken by the providers that have been created through the program in Montgomery County, it's really incredible. And those are obviously the communities that often need the most support. And so what we did was we took the program in Montgomery County and we set forth that the State Department of Education will essentially create 3 sort of pilot programs based off of the Montgomery County model in jurisdictions around the state. We're hoping that there's a diversity, that maybe one will be in an urban area, one will be in a suburban, or one will be in a rural jurisdiction or group of counties that make up sort of a childcare licensure zone. And really, we think this is a really sustainable, frankly, great model for increasing the supply of family childcare. And so for the next 2 years, we hope that the model in Montgomery County will prove to be really effective in other parts of the state, and that we'll go from 3 jurisdictions or regions that are doing this to hopefully a model that works in almost every corner of the state. And it was really heartening to hear during the last legislative session, my colleagues from typically more conservative jurisdictions that might not necessarily be as favorable towards sort of government funding or government intervention, saying this is great. We have a shortage of childcare in our communities. Can we add more here? Can we do more than 3 pilots? Obviously the budget situation again was still a little kind of hit or miss as we went through session. So we started with 3, but there's no reason why, after the 2 years or even earlier, that we could expand this to more places, and really put an even greater investment in. I think the cost for this bill is about $450,000 a year. There's a match. So the total budget for the Montgomery County program is about $300,000, give or take. And so the bill provides essentially $150,000 in funding from the state to be matched either through dollar for dollar from a county, or it could be in-kind contributions, or any other sort of resources to get it, because we know not every county is going to have it's not going to be the same size program.
That is amazing, particularly the limited cost that you just mentioned. Very attractive. Given what you've heard here this evening, what are some ideas that you have or thoughts, particularly whether it's pending legislation or other thoughts about how we might address the real access challenges, particularly for unemployed parents that we've heard about this evening?
Yeah, that's a great question, Courtney, and I'll say, I think we've made a lot of progress in Maryland. We still have a long ways to go, but I do think in some respects this is a time of incredible challenge and uncertainty. And again, the lengths that many providers have had to go through to stay open, to provide support to families during the pandemic has just been Herculean. And frankly, one of my biggest sources of frustration over the past year has been what I think is a lack of focus from this current administration in Annapolis, from the Maryland State Department of Education on really providing support. Frankly, felt many days like I was banging my head against the wall. There were often days where I was on the phone with Ruby and her colleagues from other associations, and we felt like we were screaming in the wind. With MSDE trying to get them to stand up, emergency grant programs. Frankly, our counties were much more nimble. And often we were saying, if Montgomery County can do this, if Baltimore County can do this, if Prince George's can do it, why hasn't the state done it? And so, first and foremost, it's making sure that we stabilize the existing sector. we were finally able to get MSDE to put out, their grants in February. That was based off the previous pot of money that we got from the federal government at the end of December. The first round of applications for the stabilization grant that came out of the American Rescue Plan just closed this past week. And I'm really heartened to hear that, they got a substantial number of applications. It's, I think 70 or 80% of providers applied. We know that there's going to be money left over in that pot. And our push right now with MSD is to make sure that providers who did not get, a PPP loan or any other sort of local or state or federal support, or really, in dire straits financially, get priority for what's left in that pot of money. And then there's about $200 million in funding left for sort of longer term planning. This sort of, again, President Biden had some really smart people working for him. I love the Build Back Better, but that's really what this pot of money is for. It's about, identifying the sort of long-term system needs within the childcare sector and thinking about how we actually sustain that and how we improve the system, not to where it was just before the pandemic, but actually make it so that it's satisfying the needs and meeting the needs, which, as we're hearing tonight, we're not. And so that is an opportunity. The other piece, even sort of outside of what we're doing at the state level, is, Congress is working on, potentially a once in a generation human infrastructure package through the budget reconciliation process. And, that looks like it's more of a reality probably now than ever before. Used to work on Capitol Hill before I got elected myself. And, we've been talking about universal childcare and huge new investments for probably the last decade. And, as we speak, Congress is working on that. And so I think there's an expectation now that when, the House and Senate return from their summer work period, they'll come back and they'll pass a bill that potentially could bring billions of dollars to the state of Maryland. The proposal that's out there is based off of a bill from Senator Murray from Washington State, who chairs the Senate committee that oversees childcare. That's based on basically saying expenses for childcare should be capped at no more than 7% of a family's income, which is revolutionary. But with that, we have to make sure that, as Ruby said and Tracy said, that our providers are getting paid a living wage. On average, our childcare providers nationwide make less than than parking lot attendants. And so, it's no wonder that somebody says, it's easier to go work at Target. I'm going to make more money and I don't have to deal with changing diapers and screaming children. And as a father of a 15-month-old, that's hard. It's one thing when it's your child. It's different when you're just getting paid to do it, and you don't go into the childcare field because it's well paid. You're high paid. You do it because it's a labor of love. And so, we made a lot of advancements with the Kerwin, the Blueprint for Maryland's Future. I know, as Ruby said, there's things in there that we're probably going to have to revisit and tweak to make sure that it's accessible to everybody. But I'm really excited that, with our partners in Washington, we can really think collectively in Maryland about, how are we putting state funding in to sort of fill the gaps in paying our providers appropriately and making sure that there's accessibility, that there's affordable childcare for families. I think Ruby's point is, or Tracy, who had mentioned it, we base everything off a market survey that, is inherently sort of flawed to begin with, because clearly the market in a place like Montgomery County, the market rate is going to be much higher than the market can bear in a place like Baltimore City, where I used to teach and used to live. And so, while we have increased provider rates in the state, it's a priority of our current Speaker Jones. Before she was Speaker, it was one of the big bills she worked on in her last session before becoming Speaker. We've got to make sure that rate and the system actually represents what it costs in different jurisdictions to provide that kind of care. So in terms of nuts and bolts legislation next year, one bill that we're definitely going to be working on is to provide actual infrastructure dollars, to help to start a center. It's really cost intensive to just even get a center open. And so there's a program that we've been looking at that's already on the books and just kind of tweaking that to make it more accessible. But I think in terms of a broader, bigger vision, I think, I'm really excited to see what happens with the federal dollars and really working with MSDE and the provider community. I appreciated that Farah put the dates up, making sure that, MSDE is working with the community to spend that $200 million in a way that sets us up for success, solves a lot of the problems that we've heard today. And frankly, I'm more optimistic. The new superintendent, Superintendent Chaudhry, I think is, frankly, a breath of fresh air. who talks literally every minute that he speaks about the inequities and the gaps that we have in our systems. And there's no better way to make sure that when students are older, that we don't have gaps in reading and math and scores in those areas than investing early on. That's the best way to close those gaps. And so I think we're going to have a really willing partner overseeing the State Department of Education who wants to work with the community, who really wants to bring new set of eyes and a fresh lens to the work we're doing.
Wonderful. Thank you, Delegate Solomon, and we appreciate your time this evening. We have a few minutes left, and we'd like to open it up for any questions that folks may have for any of the panelists, or any questions in general that you have around childcare issues. Farah, thank you so much for putting that information in the chat. I'd just like to draw everyone's attention back to that, because there are some real opportunities that we can act on now to help to advocate for more affordable, accessible, and safe childcare. So any questions, if you'll either raise your hand, or if I believe, Joe, I'm not sure if you said it so that people can unmute themselves. We probably have time for a question or two. All right, go ahead, Gerard.
It's not a question. I just kind of wanted to make an additional comment to round out my previous comments. And I really appreciated the discussion and all the information that I learned. So I'm looking at this, from a very practical standpoint. My team and I are really in the trenches when it comes to helping people trying to get to work, and the barriers that we run across with childcare are particularly frustrating. My wish really would be that, if the funds are available, that the process, and Tracy, spoke about it quite clearly, that the process be made so that these clients can access the funds without difficulty. To give you an example, the work requirement for the WPA, the client has to be employed. Well, it's a little bit of a chicken and egg thing for us, because they come to us for employment, they apply for the job, and at this point, they're no longer sure that they will be able to get the voucher if they're hired. And we've had situations with clients where the job opportunity goes away because they do not get the answer in time, or they're missing information and they have to resubmit. These kinds of issues, if they could be ironed out, would be a tremendous help for our clients and for our program.
Wonderful. Thank you, Gerard. So a streamlined process, I think, is something that we would all like to see. Any other questions?
Can I just follow up on that? I know, Gerard, you had brought that up before when we had a conversation with your team. And I do want to say that for us, we recognize, some of the challenges, and DHS, the Department of Human Services itself, recognizes it, and which is the reason why the Temporary Cash Assistance Program, as we call it in the state of Maryland, TCA, it's really under revamping, if you will, in terms of how this process works, where when somebody applies, and hopefully the residents that you're working with are applying for temporary cash assistance, if they have children that need care and they are unemployed. Hopefully they're starting with that process. And so that once they start that process, they can get the temporary vouchers while they are completing the process. So that's a slight shift in terms of how things have been done in the past. And in Montgomery County, I know that this process starts with different jurisdictions as they go into the new eligibility and enrollment system, the MD Think, Maryland Think eligibility and enrollment system. And Montgomery County, we are scheduled to go in November, because we are part of the last 4 jurisdictions that are going into the new system. However, we have begun this process because, again, we recognize that it's a hardship for families. And so we want to work. And I think the last time we had a conversation with you, with your team, with Courtney and Joe, we want to work with those families, but people have to apply for that program in order to be for us to be able to follow those steps. If they haven't applied for the program, they're not going to be able to use that process, because that process is specifically reserved for temporary cash assistance recipients or applicants.
Thank you, Yvonne. I think what we can commit to is to keep the conversation going. So we appreciate the response.
Yes.
Any other questions? Final comments?
I had a comment. As you know, I'm just hoping that legislators think about working families that don't meet income requirements, and just how prohibitive childcare costs are. You know, my family doesn't qualify, and we're spending over $20,000 in childcare for one child. And what I found is that there were options when we were looking in earlier this year, but they were increasingly more expensive, which is why there were spots in the centers. And thankfully, you know, we were able to make it work. But as the prices continue to increase, it's concerning, and it makes it hard for families like mine to enter the homeowner market when you're spending that amount of money on childcare.
Yeah, Cindy, I really appreciate your making that comment. I mean, yeah, as a father of a 15-month-old, I mean, you look at these prices and it's more than college tuition, frankly. I mean, if you're going to an in-state school, you're often paying significantly less than you would be for childcare. And you know, if you have multiple kids, you know, I think, again, it comes down to, frankly, what's unfortunately, you know, really a dollars and cents issue. And so, you know, we've started to chip away at that at the state. You know, again, the Blueprint for Maryland's Future really will get us to a place where we have universal pre-K for 4-year-olds, you know, and for low-income 3-year-olds. We sort of started to get there. And I think it's free for up to 600% of the poverty level. And then it's a sliding scale. So, I mean, that's 4-year-olds. That's a start. You know, I think childcare, frankly, again, is incredibly expensive. And so, you know, why I'm so excited about the federal reconciliation bill, you know, again, capping at 7% of family income, is because that is such an incredible amount of money to pay providers. Infant care in particular is so much more expensive, you know, with the ratios and just what you need to be able to do to care for a young child, a very young child. I mean, that is often something that, you know, it's cost prohibitive for states to do. And so for the federal government to step up and, you know, and share that cost with us, you know, as a state government, will be transformative. And frankly, you know, whether the federal government was going to do it or not, I think Maryland, you know, that's where I wanted us to go anyway as a state. I believe, you know, if we want to talk about equity, if we want to talk about, you know, I mean, I think one of the few silver linings of the pandemic is really the business community, you know, I think as Farah can speak to from MMF's work, has really stepped up and said, look, you know, we can't get women back in the workforce. We can't get families back in the workforce if you don't have a place for your child to go during the day, as we've heard today. But it affects people of all income levels, you know, and that, I think, is a new lens from an economic development and an economic growth standpoint that has really been lacking, I think, in this conversation as a whole. But yeah, thank you for bringing that up. That's one of the cruxes of the issue here.
I just want to add that we are also looking at increasing our rates, well, not the rates, but the income level in November. Now, while we will not be going up to 600% of FPL, we are looking at going up to about 450% of FPL. So that's a start there.
Wonderful. So I think in some ways we have now ended where we began. So for those of you who had a chance to look at the intro video that played at the beginning of the session, the last mother was essentially saying, if I could get access to childcare, I would be able to go back to work. And I think that's really the crux, frankly, of what we're talking about here this evening. We want people to be able to get back to work. This is a systematic issue, right? It's definitely a systemic issue. We are talking about the need for affordable childcare. That means that childcare providers need to be able to afford to pay their people, their employees who actually provide the care. That means the state and the county and localities need to be able to increase, as we've heard tonight, the subsidies so that more families can provide childcare. And that also means that the systems that are related to getting access to that childcare need to be more efficient. So we've covered quite a bit of ground here this evening. Thank you so much to each and every one of you for your participation, for your questions, for your attention. We thank you. This session has been recorded and it will be posted on our website and also on our YouTube channel, and we will send it out also to those of you who registered. So thank you so much for your attention and your participation. Have a great evening.
Thank you.
Bye.